Okay, go ahead.
All right. So, thank you everybody for your time. And can you see that okay? All right. Okay, thanks again. Before we really get into it, here's our disclaimer. So while I am a paralegal and Dr. McLeod is a doctor, we are not representing the opinions of our various governing bodies, being the Law Society and the Physician of College and Surgeon, or College of Physicians and Surgeons. And these opinions are only based on today, December 19th, 2022. The legislation could change tomorrow, and then this would all be irrelevant, of course. So what we're going to talk about is the disability tax credit. So for the ones who are on here, what do you think our percent of our population are medically impaired enough to be considered disabled and therefore eligible for the disability tax credit? So I'll get you to throw your answers into the chat. Okay, 50%. Is there any other thoughts? 20? Good guess. All right, so the answer is 22%. Okay, so when you figure pretty much 1 in 5 of the folks that you know in your life would be considered disabled, that number is obviously quite high. Here's a bit of our agenda. We're going to talk about what is it, how do you apply, what are the benefits, what do you do, are there any negatives? So first of all, what is it? It's a non-refundable tax credit. So that means you get the value of the income of the credit, you get the income tax back on it. So right now the credit is worth about $8,500 provincially and federally for 2021, but you don't get $8,500 back, right? So you get the income tax you've paid on that money back. So as an example, somebody making $40,000 or $50,000 a year should look to get somewhere in around $1,500 back. So we apply to Canada Revenue for approval to this program, and it's based on newer disability criteria. So if you think back to when you were maybe in high school and to be disabled, you were blind or deaf or in a wheelchair, that type of thing, that's no longer relevant, and we're going to go through that. One of the big things is that the credit is potentially transferable. So that means that someone who is maybe has a lower earning potential due to either age or medical impairment, we can take this credit and transfer it to a qualifying person and then get a refund through them. So the purpose is to save you your own money. So to keep your income tax money in your own pocket. It's retroactive as far back as 10 years if you were medically impaired that far, and it can lower your tax burden for future years. Generally, the two biggest things that we see is somebody who gets approved for the next 5 years and then has to reapply with updated medical, or they get approved for the rest of their life. But this also gives them access to other programs. So I'm going to rule out some of the issues that we see with clients as to why they say they should not get this credit. So to become eligible, it does not matter how young you are. So we do have elementary school clients who've been approved, as an example, for a learning disability. It also doesn't matter how old you are. So we've had clients over 100 years old approved. Whether or not you work, totally irrelevant, right? So there's no reason somebody with, as you can see here, in a wheelchair could not work. Doesn't matter how much you earn. We have clients who make well over 6 figures and they still get approved for this credit. Where you want to start is that you can apply if you've had a medical condition where your symptoms have been present for 12 months or more, not necessarily diagnosed, but you've been symptomatic for 12 months or more, or it's going to be present for 12 months or more, such as a stroke, and your symptoms are present at least 90% of the time. And Dr. McLeod will get into that a bit more. So the application is divided into 4 sections, as you see here, the most common being the physical that we use. So Dr. McLeod, I'll get you to start with here.
Okay, so the tax credit has qualifying conditions that affect vision and also hearing, and each of the criteria are fairly well laid out in terms of what qualifies or the degree of impairment that you need in order to meet their criteria to qualify. So in the case of vision, the visual acuity for a person is actually quite severe. It's 2200 vision, which is think of the big E on the Doppler's eye chart. The worst eye has to be the big E, and the better eye can't be better than 2050. So that's very strictly laid out. There's also criteria for vision in terms of field of vision. So if you might be familiar with glaucoma. Glaucoma is a condition where you start to lose the outer part of your vision. So you can see okay in the center of your vision, but on the outside you start to lose that. So if your field of vision is 20 degrees or less, then you qualify for this as well. So for a senior population, conditions like severe cataracts, severe prolonged glaucoma, and most commonly age-related macular degeneration is apt to qualify. These are the kind of conditions that we would be thinking about in seniors. As well, there are other conditions that affect your vision. So for instance, Bell's palsy can affect your vision in one eye. A stroke can have an effect on vision as well. Any illness that winds up affecting the motor activity of the eye or the orbit of the eye might fall under this category. In terms of hearing, the criteria are that a person has difficulty hearing in a quiet environment with somebody familiar with them in both ears, despite the use of hearing aids. So regrettably, if a person has a hearing aid and it helps their hearing, then they would no longer qualify. But hearing aids can be very expensive and too expensive to get until you maybe get a refund back from the tax credit. So if a person hasn't been able to afford hearing aids and they have hearing loss that's documented in both ears, they may be able to apply and qualify. There are criteria as well for walking. So the strict criteria for walking, according to CRA, is the person either cannot walk or takes 3 times as long to walk a given distance as someone who is not impaired. So I've had lots of arguments with my fellow physicians over whether a person needs to be in a wheelchair or not in order to qualify for this credit. That's a common misconception among my colleagues. But walking can be qualified for this credit by a host of conditions. So yes, if the person is wheelchair confined, they'll absolutely qualify. If the person has a limb difference, they'll qualify under this credit. If you think of a person who has a lower limb amputation, if a person has a condition where they have to put a brace on in order to walk or stand up, any condition that affects a person's balance will likely qualify here. Or if their cardiac or respiratory condition is not good, so a person with heart failure, a person with chronic lung disease or emphysema, these will all qualify under the walking criteria. Another physical impairment that qualifies is under elimination. So basically, if a person has difficulty managing their bowels or their bladder. So again, if a person takes an inordinate amount of time, or 3 times longer than someone who isn't impaired, to manage their bowel or bladder function, then they'll qualify. So a person with a condition that causes a lot of diarrhea, for instance, Crohn's disease or colitis, that will qualify. Irritable bowel syndrome, where a person has a number of bowel movements per day or a lot of abdominal pain and cramps, they may qualify here as well. Persons who are incontinent of their bladder will qualify. So think of all the seniors who have incontinence problems, and this is one of the probably most common and yet underutilized areas where a person could qualify. Under this category as well, I have to mention that if a person has a condition that has resulted in an ostomy or a bag in order to manage either their bowels or bladder, then they'll qualify under this criteria as well. The credit also has qualifying for people who have difficulty dressing. So again, any condition that results in a person taking an inordinate amount of time to get dressed. And again, that is someone that takes 3 times longer as an unimpaired person will qualify here. And again, a person consider someone who has had a stroke or who has paralysis of one limb or the other that will qualify here. If a person has weakness or pain from arthritic conditions in their shoulder or neck or their upper extremity or lower extremity as well, osteoarthritis, rheumatoid arthritis might fall under this category. Persons who have amputations and have prosthetic limbs will qualify under the dressing category as well. One of the most common in older persons is a condition called polymyalgia, which is a condition where a person has pain and stiffness in their neck and shoulders and upper limbs. And as a result, they have a hard time getting clothes on and off, and qualified lots of people with that condition under this category. Disability tax credit also has qualifications under speaking. So if a person takes an inordinate amount of time to get their words out or to be able to be understood by someone who's familiar to them. So an illness that affects a person's speech might be a stroke. That would be one of the more common ones. A severe case of Bell's palsy might also qualify here as well. A person who has aphasia, which is a complication, most commonly a complication of stroke, might qualify under these criteria. CRA will allow a person who has difficulty with feeding qualify for the disability tax credit as well. So feeding involves there are conditions that can affect a person's ability to prepare food, and then conditions that will affect a person's ability to eat food. So again, being able to stand at a stove or oven and prepare food if a person has dexterity problems with their hands or arms, or they have weakness in their legs or a bad back so that they can't stand for a prolonged period of time, they might qualify here as well. As far as digesting food, a person with difficulty swallowing, so esophageal strictures or feeding tubes will qualify under this category as well. So we talk about this a lot of times. There are visible disabilities and invisible disabilities, particularly when we're talking about mental illnesses, this is our kind of lead up into talking about the mental conditions that qualify for this credit. Before we do that, are there any questions about the physical impairments? So in the last iteration of the disability tax credit form, CRA, have to say, did a really good job at outlining how mental functions qualify for the tax credit. So there are conditions that cause issues with memory or judgment are very clearly outlined in the criteria now. Still feel like that persons with mental illnesses and mental functions face a little higher burden to prove their condition compared to the physical impairments, but it's considerably better laid out in the tax credit form now, so that it's very clear that conditions such as anxiety, depression qualify, as well as illnesses that will affect seniors like dementia or Alzheimer's disease much more clearly defined in this area, as are the learning difficulties. So like dyslexia and other forms of learning disability, autism spectrum disorder qualifies under the mental functions as well. CRA also has qualifications for life-sustaining therapy. In the news in this last year, we've seen that CRA will automatically approve persons who have type 1 diabetes, and that's great, because that's one of the more common conditions that will be qualified under these criteria. So this qualification is for conditions that require a significant time element to their management. So a person with diabetes who has to monitor their blood sugar, alter their insulin dosages, keep a record of their sugar numbers, and those types of things fall under this area. Another one that's not quite as obvious is cystic fibrosis. People who have cystic fibrosis have to go for chest physiotherapy, and the time commitment there results in them qualifying as well. And one of the other common one in this category is renal dialysis. So patients who have to go for hemodialysis a couple of times a week will qualify here. The strict criteria are any condition that requires 14 hours a week or 3 times a week, 14 hours a week or 3 days a week in order to manage their condition. And then finally, there is an area for qualification called the cumulative effects section, which addresses a situation where a person may have 2 or 3 different conditions, all of which impair them to some degree, but not strictly enough with those strict definitions to meet one criteria, but taken together are as impairing as if they did have a qualifying condition. We don't tend to use this one a whole lot in our line of work, because most times the conditions are pretty clear where they fit. But this is another great way to plead the case for somebody, particularly with a complex case or with a number of small insults or conditions to the body that alone don't qualify, but taken together they would. So here we have some of the more common conditions that get qualified. So again, the misconception among a lot of my colleagues is that you have to be, in a wheelchair in order to qualify, and that's obviously not true. A person with arthritis will qualify if the arthritis is quite severe and impairing. Diabetes is a common condition that we mentioned in different ways. It can qualify. We've got COPD mentioned there, that chronic lung disease, chronic heart disease, heart failure, we can all find a way to explain to CRA how they impair a person and how they meet the criteria for qualification.
So thank you. So some of the issues that we've run into in our preparation of these applications over the years is, of course, Canada Revenue. So part of the problem is that they would change our target and not really tell anyone. So these applications were written based on old criteria. Things were getting denied. And then there's, of course, the decision makers where, we disagree with their decisions. We think that there has been enough evidence and they still deny it. So we have to go ahead and do objections to their denials. Unsure medical practitioners and their time demands. So Dr. McLeod addressed this a bit, but it's definitely a time constraint on doctors and other medical practitioners that nobody wants to do more paperwork. So we're trying to take that aspect away as far as the disability tax credit goes, so that the patient can go into the practitioner with it prepared and prepared correctly to meet CRA criteria. We also run into a lot of confused and misinformed clients. So when you look at that first sentence about my neighbor has cancer and gets the credit, you really could substitute cancer with other diagnoses, such as Crohn's or diabetes. But there's a world of difference from having a small skin cancer to a lung cancer where you have a lung removed. Same with diabetes. Are you simply diet controlled or are you on dialysis? You still have the diagnosis of a diabetes, but there's a world of difference in severity. And there are folks who are concerned that their employer is going to find out. Well, we certainly won't tell them, and CRA can't, and your doctor can't. So the only person who would tell them would be you. So there is no worry that way. And people don't want to be labeled. And usually that is just the source of pride. But again, no one has to tell you, or sorry, you don't have to tell anyone that you're eligible for this. That's your own private information. So I've done several thousand of these applications. And when I first started doing them 11 years ago, one of my concerns was, is there any negatives to this? You know, whether it was short-term or long-term disability or CPP disability. And the answer is no, because this is not income, right? This is your own tax dollars coming back to you. So there are no negatives. And of course, the other question is that, is it worth it? Is it worth going through the hassle, if you want to call it that, to get the paperwork in and submit it to CRA? Here's some of my firm's past examples. So when you look at Mark, $7,500, the 5 in brackets means how many retroactive years of approval did he get? So here he averaged about $1,500 per year. But if you go down to the bottom of that column, Jean getting $10,000 for 10 years, she was $1,000 a year. Now there's a number of reasons why you could see a difference. Some of it could be that somebody was often short and long-term disability, and that was not taxable income, or they went on WSIB's loss of earnings in Ontario, which is not taxable as well. So there is quite a variety, but keep in mind, you can go back up to 10 years. So we did 3 case studies. An RCMP officer in Alberta, keeping in mind that Alberta has higher provincial rates than Ontario does, and significantly higher. So he had PTSD, and we were able to get him approved and a $25,000 refund. We also did a 52-year-old retail worker around the Guelph area with IBS, working full-time. And she got approved for life with a $15,000 refund. Then the third one was a minor with a learning disability who came to us after being denied several times. So we did an exhaustive medical review and rewrote the application, and it was approved. So if you look at these 3 examples, you'll see a professional as a police officer, a blue collar as a retail worker, and then a minor. All of them got approved. All of them got money. The minor got money through a parent. So that's how that income came in. So when you look at the benefits for you or your client or your family member, so you're looking at potential retroactive as well as future tax relief, but access to other credits. So you'd be looking at the caregiver amount and infirm dependent amount, to name a few. But the big one is the registered disability savings plan, which of course there's age restrictions for that. So that's the end of our presentation. And we're going to open it up to questions. So you can either unmute yourself and go ahead and ask it, or you can type it in the chat, whatever you prefer.
Peter, we would be remiss if we didn't also say that there are other benefits that you might actually be able to tap into once you have an approved disability tax credit. So if you're working, you might be able to claim the Canada Workers Benefit. If you own a home, it could be the home buyer's amount that you get. It could be the home accessibility tax credit, which has just increased as well. For people who have children, it could be the disability amount for children. It can be the child disability benefit, increased childcare deductions. Then there's I think the other one has gone away. The other benefit there. If you're say a person who has a caregiver, then there's 2 potential things that might help you if you have the disability tax credit certificate in place, and that is you could claim the disability supports deduction for attendant care services, and there's also a caregiver credit that you'd have access to. For people that have trusts in place, having the disability tax credit actually is your eligibility for electing that trust as a qualified disability trust. And there's also a preferred beneficiary election option there. And then if you're a student, there's certain other related benefits that you can get when you have the disability tax credit. And my daughter just went through an application with OSAP and ended up getting more money as grant and additional monies to be able to purchase the things that she needed to support her at school. There you go.
Nice, thank you. Okay, any questions at all? No, any comments about the the physical impairments? Oops, sorry. Keeping in mind, one of the big things is the expression or definition that CRA created for inordinate amount of time. So it means you are compared to someone of your same age who has no medical impairments. And the question asked of the practitioner is, do you take 3 times longer to perform that activity, such as dressing or feeding or managing your bowel or bladder functions?
And I'll
So-
take the next question that came up
Yep.
here. So Jack's question was, how do we help with the application? So I don't know if you read my story on LinkedIn, Jack, but my daughter essentially qualified for this credit when she was about 6 years old. And we had her assessed at various different times, at 6, at 12, and again at 18. I was having a really hard time getting this. And I realized there's a kind of there's a few things that contribute to people having a difficult time receiving this credit. So one is the paperwork is fairly complex to be able to fill out. 2, medical practitioners may not always understand fully the qualification criteria, and we see this fairly often. 40% of Canadians don't have a family doctor, presumably to be able to fill out the credit. So this was all part of the genesis of us creating Benefits 2, and really what Benefits 2 is, and we haven't fully launched yet. So number 1, it is a web-based application. So we walk you through a series of questions at the very front end, and through those series of questions, you would get, you're likely to qualify, or based on your answers, you're likely not to qualify. But if you feel like you want to go forward and do the application anyway, that's your prerogative. But for those who are likely to qualify, they're then guided through the application. It's a series of questions related to their impairment, to their activities of daily living. And then we've created a very complex algorithm. So the complex algorithm that we created will then write the application for you. And it'll give you a PDF of that application at the end and a code to take to your physician or other practitioner who's going to sign this off for you. And when you take that to them, they'll be able to pull up your application. They'll be able to review it, edit it if necessary, print and sign it in less than 5 minutes. Physicians' biggest beef with this today is that filling it out from start to finish takes about 20 to 45 minutes, depending on your impairment and their level of expertise with this form. And we know that physicians are very time-based. They, typically can see a patient about every 7 to 10 minutes. And so if it was going to take them a half an hour to do this, they could have seen 3 patients and billed through OHIP for that, or whatever your provincial association is. So we wanted to make this process easier for both sides of the equations, both for Canadians with disabilities, but also the medical practitioners that serve them. And this was our response to that, was to be able to prep their application for success, and then be able to save the practitioner time when they're reviewing and editing it. Now, if you do not have a practitioner to sign your application, correct me if I'm wrong, Jeff, but there's going to be a mechanism within the application that'll say, I don't have a practitioner to sign off on this. I would like a list of practitioners that I could contact to see if they're willing to see me and review my disability tax credit. And then we would forward that list onto them in an email. Oh, and I should outline the cost too. So if you know anything about this, you'll know the government tried to bring in some legislation. Actually, they did bring in the legislation on November 15th, 2021. And these were recommendations put forth by the Disability Advisory Committee. It's a committee that advises CRA and the federal government. And they thought that the predatory nature, or we call it that, but the disability tax credit promoters, the wide majority of them, they're not all built the same, we'll tell you that. But many of them charge on a success rate, similar to a lawyer. When a lawyer gets a settlement for somebody in an accident claim, let's say, or in a wrongful dismissal, anything like that, they charge a success rate on the amount of money that they get for you. The disability tax credit promoters are very much like that, but the government was seeking to set the fee at no more than $100 for helping with the application, and no more than $100 for each year for doing the tax adjustments. They brought that in on November 15th, but at the same point in time, one of the promoters did find a way of circumventing the government. And they said, listen, your federal government, we're really regulated by provincial authorities. And therefore, the federal government really can't fix our fees, given that they don't have a jurisdiction over that. So they were able to win, and that's where it sits today. It's kind of tied up in court, and this interlocutory junction was permitted by the courts against the federal government. So unless they find another way to bring this legislation to fruition, it won't happen. But what we said is we wanted to make sure that we found a way to leave as much money as we could in the pockets of those with disabilities and their family members. And so our response to that, again, was benefits too. In pre-launch phase, we charge $49.50 for doing the application. Once we're in full launch, it will be $99. Then there will be a webinar specifically for wealth advisors, insurance advisors, lawyers, and accountants happening on January 30th is the projected date for that. And we'll go over a full suite of how we can support you with this. Sorry, long explanation, but I wanted to give it all to you. Any other questions, Jack? Awesome. Okay, great. And so in the meantime, because we haven't pushed the launch of the app out there, everybody who's attended or has registered to attend today will get a copy of the presentation. They will be directed to our website, which is not quite yet finished, but we're getting very close to that. And I believe the link is there, but we're not in full pre-launch. But as soon as we are, you'll be able to go through and utilize the application that's attached. It's on the website. It says apply now. And when you hit that button, it will take you right to the application. We'll be putting more information out as we pre-launch and then fully launch as well.
Okay. Any last questions or comments? No. Okay, so then we'll thank you for your time, and we appreciate it. And we're looking forward to working with all of you in the future. And please don't be shy. If you have any questions, feel free to reach out. Okay.
Yeah, in the email you'll get, there's again, this information that's on the screen right now, the telephone number and the email address as well. Those will both be in the email too. So if you have questions, if you have clients that are, if you're an individual that wants to apply, just reach out to us and we'll help you work your way through the process for the moment until we fully launch. Thank you for coming, Helen.
You're welcome. That was very good.
Oh, thanks. I'm glad
I
you.
wish my doctor would watch this.
We'll see what we can do about that in the future.
Yeah, okay. All right. Thank you.
You're welcome.
Thanks, everybody. Good night.
Thanks.
Good night.